President Obama is set to make a primetime speech to Congress about health care reform next week. He's trying to ease growing public skepticism over his plans. CBS News senior White House correspondent Bill Plante has more. Good morning, Bill.
Good morning, Harry. You can tell they're concerned here when they start trotting out the usual cliches. They're calling it make or break time, 4th and 10 for the White House goal of health care reform. But this time, they say, the president will give Congress more of what it's been asking for, specifics.
No one who watches the speech will leave the speech without a clear sense of direction about how we can achieve the goal of bringing stability and security to people who have insurance and to help those Americans who don't.
The president isn't writing his own bill, but he will make some choices.
The debate and discussion has been going on for months, has elicited many ideas. They're all on the table now. We're in the final throes of this debate, and it's time to pull the different strands of thought together and say, here's how we get to the finish line.
The president has already given 27 speeches on health care reform, and he's mentioned it 92 other times. But two-thirds of Americans say they don't understand what's in the bills Congress has written.
I think what the president should say is, I ran to change the tone in Washington. We've descended into partisan bickering, and we're going to lift this debate up.
So the speech is an attempt to regain control of the debate after a very bad month. The speech will also signal that the White House is open to compromise. And they firmly resist here any idea that this is, as the Republicans keep saying, the president's Waterloo. They say things will be much clearer after the president talks. Maggie?
One more cliche, Bill. Hail Mary pass. Thanks a lot. Bill Plante at the White House. CBS News Chief Washington correspondent and host of Face the Nation, Bob Schieffer, joins us now to talk more about this. Good morning, Bob.
Good morning, Maggie.
President Obama has already made 27 speeches on this, and people still don't get it. Congress still doesn't agree on it. Do you think it'll make a difference that this speech will be before a joint session of Congress, something that is usually reserved for the State of the Union? And what can he say that he hasn't said, Bob?
Well, what he can say is exactly what he is for, and that's the problem, Maggie. Here's what's going on. When Hillary Clinton was the first lady under her husband, Bill Clinton, she designed with some experts a plan for universal health care coverage. They did it in secret. They gave it to the Congress, and it dropped like a stone. Congress wanted nothing to do with it. It may well be that the Obama people learned the lessons of that all too well. So the president did not get specific. He just laid out general principles about what he said he wanted to see. But Congress never really got details on what he was prepared to go to the mat for. So, you know, when you're asking the Congress to vote for something that probably is going to include tax increases of one kind or another, they have to know, is the president, especially the ones in their own party, is the president going to be with them on that to the end? Because no member of Congress wants to make a controversial vote like that only to find out later that the limb they were on was sawed off behind them by the president himself. He has to get specific, tell them exactly what he's for and what he's prepared to back them on, because as former Republican leader Bob Dole was saying the other day, Maggie, this is not just a vote for health care for some of these people in the Congress. This is a vote for their survival. Nobody likes to be on the record on things like raising taxes unless they know somebody else like the president's going to be with them. That's what he's got to talk about.
Last week, after Senator Kennedy passed, I asked Orrin Hatch, the Republican senator, if Senator Kennedy's passing could be sort of the impetus that was needed to finally get Republicans and Democrats to work together on this and fulfill Senator Kennedy's dream of health care reform. And he said, it's a nice idea, but no, if the Republicans don't like it, we're not going to vote for it. Do you think the president will convince Republicans to compromise, to move in his favor on this?
I think mentioning Senator Kennedy might well change the tone of the debate, tone it down a little. But I have to say, I agree with Senator Hatch on this. I think at this point, there simply are not the votes in the Senate to pass the so-called public option, the government insurance plan. And that's where the big hang-up is on all of this. Liberals want it in the plan. Conservatives and some of the moderates say they just can't vote for that right now. So we'll get some of the details on exactly where the president is on all this. Unless he is ready to give those details, frankly, this speech is not going to work, Maggie.
All right. CBS's Bob Schieffer. Thanks, Bob.
Thanks, Maggie.